Hi, this is Dr. Eric Winder with 4 more simple exercises for retraining proper diaphragm breathing. Quick disclaimer, check these out with your qualified healthcare provider first to make sure they are okay for you. Just a quick review. Why do we want to be breathing with our diaphragm instead of the common stress breathing pattern of breathing up into the chest? And the answer to that is when we expand breathing with our diaphragm down into the lower rib cage, we oxygenate better, we lower our stress responses, lower the tendency to anxiety, we increase our core strength, the strength of our abdominal and trunk and low back muscles. We also improve oxygenation if we're having difficulties with breathing due to asthma or COPD or a lung infection. I have another video under the title Breathing Better that goes more in depth on this. Now, the next 4 breathing exercises that I'm going to show you all use different tricks to help encourage the right muscular usage to make it easier to expand and breathe with your diaphragm down into the lower rib cage. The first one works like this. You interlace your fingers in front of you, and on the in-breath, you're going to squeeze and press your finger pads into the backs of your hands. This actually tends to tighten muscles in your rib cage, which encourage diaphragm breathing. So the in-breath, you're squeezing, and then you relax on the out-breath. Exercise number 2, grasp a wrist with your other hand and pull away from you slightly. And again, this tensions certain muscles in your rib cage that help encourage diaphragm breathing. You pull on the in-breath and then relax on the out-breath. Pull on the in-breath, relaxing on the out-breath. Now, different people have different reasons why they have difficulty with diaphragm breathing. Sometimes it's due to old injuries and muscular restrictions that may be unequal. So if this doesn't work on one side, try it on the other side. You might feel that that improves your diaphragm breathing. The third exercise, hands on the back of the head and curling slightly forward like this. This makes it easier to breathe and expand into the lower rib cage. This is easiest to do when you're actually leaning back into a chair and have some kind of support. The fourth exercise is a variation with the hands. And in this one, this exercise tends to work best for people who tend to have anxiety or have difficulty breathing and shortness of breath from asthma or COPD. And the way it works is you simply slowly open your hands as you breathe in, and you slowly close your grip as you breathe out. And open your hands on the in-breath, close your hands as you breathe out. So the next bit we need to go over is how long do you do this for and how often? If you have a chest breathing pattern, you have very restricted breathing and difficulty breathing down into your diaphragm, then you need lots of practice to retrain diaphragm breathing. So I recommend doing this several times per day, as many times as you can for a few minutes. Also in the evening, when you lie down to go to bed, it can be very helpful to do these breathing exercises for 5 to 10 minutes to help to reset your musculature into diaphragm breathing, which helps calm down your fight or flight stress responses and can really improve the quality of your sleep. When you do this breathing, there's one additional point. You want to breathe out for a longer time than you're breathing in. And the way you want to do this is breathe in through your nose, but breathe out through pursed lips. So your lips are almost closed. So you're creating back pressure as you blow. And this does 2 things. Number 1, increasing the time that you're exhaling makes you retain a little bit more carbon dioxide, which helps calm down your sympathetic nervous system. And also the back pressure helps to oxygenate the lower parts of your lungs more. Everybody is different. You want to choose the exercise that makes it easiest for you to breathe down into your lower rib cage instead of up into your chest. You may actually find that one or two of these exercises actually makes it more difficult. So choose the one that works best for you, use it regularly, and over time, you can start to retrain a much healthier breathing pattern. If none of these exercises works for you, if none of them allow you to move better, to breathe and expand down into your lower rib cage, you may need to seek out the help of a qualified manual therapy professional, somebody who knows how to release the restrictions in musculature and connective tissue to allow your rib cage to move properly, to allow you to breathe properly. Otherwise, when you find one that works, use it regularly. Over time, you should see good results. Thank you for tuning in. Stay safe and be well.